Well, welcome everyone, and thank you for joining us for this, I think, really important and timely webinar. I'm Kris Brown. I'm the president of Brady, and we're extremely grateful and excited to partner today with Doctors for America to host this critical event about extreme risk protection orders and safe gun storage. They really go hand in hand. And we're so excited about the incredible speakers that we have with us today, including Representative Madeleine Dean, who's joining us. Hello, Representative Dean, from Pennsylvania's 4th District and a long-standing gun violence prevention champion and advocate, as well as Dr. Janis, a psychiatrist from Madison, Wisconsin, who serves on Doctors for America's National Steering Committee. Welcome, Dr. Janis. And Mel Wilson, the Social Justice and Human Rights Manager. Hi, Mel. With the National Association of Social Workers, who are doing so many great things for our nation, and especially are on the front lines often of entering homes of clients who may have guns in the home. Thank you all for taking the time with us today for these really important and life-saving conversations. I think what's really important before I kick it off and really turn to each of you, the context, I think, is important often for folks who are involved in the gun violence prevention movement to understand how each of us came to be a part of this movement for gun safety and why we think things like extreme risk laws are so critically important to protect the lives of Americans all across this country. So I'd like to kick it off, and I'll start off, but ask each of you to talk a little bit about what brings you to the cause of gun violence prevention and some of your thoughts in particular about the importance of extreme risk laws. So obviously I'm the president of Brady, one of the nation's oldest and we'd like to say boldest gun violence prevention organizations. For me, I came to the issue as a mom, as an advocate, and as someone who worked on Capitol Hill to start off my career from 1990 to 1998, when the Brady Law was actually finally enacted after 6 years and 7 votes. Obviously, a lot of time has passed since the Brady Law was enacted, and what we know today is that we have an epidemic of gun violence across this country. We have 40,000 people a year who are killed by guns across this country, and nearly 80,000 additional people per year who are shot and injured and have to live with the consequences of those injuries for the rest of their lives. There's no question that stronger laws are necessary to protect our citizens. And there's no question that stronger laws, when implemented well, can work. If you look at the state of California, which has really led the nation in enacting comprehensive and strong state-level laws to protect their citizens, what you see is a significant reduction in gun deaths and injuries in California over the last 20 years compared to the rest of the nation. So gun laws and strong gun laws really do work, but implementation is also critically important. One of the rising aspects of gun violence in this country is actually suicide. About 60% of all gun deaths in America, of that 40,000, are actually suicide, and they're on the rise. And unsurprisingly, individuals who are at the highest risk of suicide by gun are people who have guns in their home. Extreme risk laws, to me, are so important because they help ensure that individuals who are at risk of harming themselves or others, their family members and law enforcement, can remove guns for a temporary period to ensure that they have the appropriate amount of time away from a gun and whatever situation they're facing to be able to get past that temporary crisis, because often these are temporary crises. One of the best studies that have been done about the importance of extreme risk laws are in the state of Connecticut, which has one of the longest standing extreme risk laws of any state in the country. It was passed actually shortly after Sandy Hook. And what they found, all things being equal, is up to a 50% reduction in suicide in the state of Connecticut as a result of the enactment of that extreme risk law. For us at Brady, this has been a major initiative for us to really help educate all of the stakeholders who are on the front lines of interacting with individuals who may be at risk. One of the most important groups of influencers are obviously physicians. So I'm so pleased to have Doctors for America as part of this, and also social workers who are often interacting every single day with clients in their own homes. And of course, Representative Dean is on the front lines of trying to make sure that our laws are expanded to ensure that more states actually not only enact these laws, but also have appropriate funding to implement the laws. So that's why I'm so excited about this particular webinar. And I want to turn it over now to Representative Dean to spend a couple of minutes talking about what brings you to this cause and some of your goals around extreme risk laws. I think you're muted, Representative Dean.
I'll try that again. I should know this by now. We've been Zooming for months. Thank you, Kris, Angela, Melvin. It's an honor to be with you today with Doctors for America and, of course, with the Brady campaign. I've had the chance to work with Brady for many, many years now. And you bring such heart, such credibility, such intellect, so thank you. Kris, a little like you, I've cared about this issue my entire adult life. I think back to when my 3 now grown sons were little. It was the year 2000, and we had the Million Mile March in Washington, D.C. I wasn't elected to anything. I was just a mom who cared desperately about the issue of gun violence. So my husband and I came and participated in the Million Mile March. And I've been interested in it and cared about it ever since. In the meantime, I became a lawyer. Then I taught at a university for 10 years in Philadelphia, Pennsylvania, where my concern for gun violence and illegal weapons grew and continued. Sadly, one of my own students, an adult night student, one of her twin boys, she had beautiful 16-year-old boys, was shot and killed for no reason by another teenager. And she said to me at that time, she said, "Promise me you'll do something about this." I was only a teacher. I was not elected, but her words stuck with me. I then went on to become a member of the Pennsylvania House and introduced legislation in the minority in the Pennsylvania House session after session with many other members. We seldom got anywhere. After Sandy Hook, I formed the PA Safe Caucus, and I was actually chided for starting a caucus because I was a freshman. I had no business starting a caucus, and I really had no business starting a caucus when I wanted to talk about guns in Pennsylvania. But we started it, and we worked hard, and that caucus continues, and the work continues in Pennsylvania. To your point, Kris, when you add 40,000 souls a year with 80,000 others who are literally wounded, caught in the crossfire, that's 120,000 people a year. You do the math. That's today, 328 people. I call it a jetliner a day. And it's Monday, it's Tuesday, it's Wednesday, it's Thursday, it's 365 days a year. A jetliner goes down in this country, taking, killing people, but also injuring people. When will we wrap our hands around it? So I've cared about it a long time. When I ran for Congress, I wanted to be on the Judiciary Committee because I thought, here we will talk about this. I talked about it on the Judiciary Committee in Pennsylvania, but we were in the minority. And guess what? I was able to get on that committee, and Chairman Jerry Nadler very purposefully had our very first hearing in this new Congress with a new Democratic majority on the topic of gun violence, to send the message, we are serious about doing something about this in this country. And you saw, we passed 2 bills, first out of committee and then out of the House of Representatives. That was February a year ago. We passed H.R. 8, Universal Backgrounds. I had a chance to talk, and it relates to ERPOs, I had a chance to add an amendment to H.R. 8, the Universal Background Check, which would give people permission to transfer with immunity their gun if they thought they were in grave risk of self-harm or harm to someone else. I didn't want to have a background check get in the way of that trauma moment where you actually recognize, or somebody recognizes they're in serious crisis, as you pointed out. That passed, that became a part of that bill. But that bill, of course, languishes in the Senate, going nowhere. I hope we change that soon. Maybe the elections will change that. So we'll begin to save lives. We also passed HR 1112, closing the Charleston loophole. But you know from the Charleston case, one of the connections to ERPO, the shooter there, Dylan Roof, his friend knew he was in grave crisis, took his gun from him just prior to the shooting, but fearing for his own liability for taking the gun, gave it back. So in addition to the Charleston loophole piece on background checks, we have the ERPO piece. His friend was trying to do the right thing, but the laws didn't back him up. We need to make sure we do that. So I will say also that I'm very delighted that in our committee, we have taken a look at, I'm trying to figure out the date, hold on here. We have two bills that have been brought forward, two ERPO bills, one with Representative Carbajal, Fitzpatrick, Deutsch, Breyer, and Senator Feinstein. And that was passed out of our committee last, I'm looking at the date, September the 10th of last year. So that would help establish grant programs for states so that they could enact ERPO laws and support those enactments. We also have another one that has been introduced that has not yet been taken up for consideration. It's a federal version by Lucy McBath, also a member of Judiciary. I hope that we will see this first bill on the floor. I don't know that it will make it this session, but I've been fighting for it. We know that ERPOs make sense. And back in the Pennsylvania House, they have a bill languishing also not to come forward. I want to use one quick anecdote that tells you, to me, the very common sense notion of this, and I'll stop then. Years ago, my sister-in-law was struck and killed by a drunk driver. The drunk driver was found to be a neighbor, literally the backdoor neighbor to her. Her then fiance had a gun in his home. And when my husband and I went down to try to take care of some things, recognizing he had a gun in his home and recognizing how extraordinarily distraught he was, we didn't ask him, we took the gun and just concealed it. And he never asked, we gave it back later. But it was just that common sense notion that something terribly wrong could go on top of a tragedy like the death of my sister-in-law. That's all ERPO does. There are many versions, and that's why I think we need a federal version, because we have 15 states or so that have ERPOs. They're all different. We need a federal standard. So in a common sense way, people could come forward and say, either I'm in grave trouble, please help me and make sure you take my guns, or my family member is, or my patient is. So with that, I'll toss it back to you. I'm hoping we will continue to make progress. Proud to work with all of you.
Thank you, Representative Dean. And as always, after listening to you, we're just so incredibly grateful that we have your voice in Congress on behalf of all Americans who believe in common sense gun safety laws. You're an incredible champion, and thank you. Mel, I'm going to turn to you and ask that you talk a little bit about what brings you to this particular issue, both for you personally, because I know that you have some experiences we've talked about that bring you to it, as well as on behalf of the National Association of Social Workers.
Thanks, Kris. To begin with, National Association of Social Workers, we're about 120,000 strong with chapters in every state. And Kris, as you remember, several years ago, you had a dialogue with our CEO, and we all discussed about the public health crisis that gun violence has wreaked upon us. And many of our members are really, really concerned about that. Our CEO, myself, because I actually, not a direct experience with guns, but certainly worked as a social worker many years ago, working in the inner city and dealing with gun violence, and it is in the inner city, and the perspective that I got from that. You guys hit on a couple of points that are really important. the 40,000 that die, but the 80,000 that get injured, and the devastation of gun injuries is unspeakable. And social workers are very, very much involved with the prevention side of it, the aftermath of it too, because a lot of these families wind up within the public welfare system or within the hospital systems, and we're involved with helping them make a transition to a tragedy that they've experienced. So this is an area for social workers that is critically important, and we remain committed absolutely to working with Brady on many aspects of it, and working with Bettina, who's my buddy, and we really worked on a number of very important projects. There's another thing I just want to raise, given the conversation going on now with the issue of police and excessive force in police. There is a piece in there looking at ERPO, and I know that often is the petitioner for ERPO or law enforcement, and figuring out how to make that happen where that there is an approach that will reduce that tension that is there when they have to execute an order, and working with the families and the anxiety that the families go through. So this is maybe a chance for some re-examination on that would at least mitigate the possibility of force being used at the time when there's a ERPO order executed. But having said that's where we are as an organization, that we are firmly committed to it, something that, again, emphasizing the public health aspects of it and the crisis aspects of it, and the need to mobilize as strongly as possible many disciplines to bring some change to this problem.
Thank you so much, Mel, and thank you for everything that you're doing and that National Association of Social Workers is doing to tackle this issue. You have been an incredible partner to Brady, and we're just thrilled that you all are taking such a leadership role on this issue.
I appreciate it.
Dr. Janis, I'd like to turn to you to talk a little bit about your personal sort of experience, and also on behalf of Doctors for America, you're doing some great things with some other gun violence prevention organizations. So I thought you might want to also talk about that.
Sure. So thank you very much for having me here today. And I'm so honored to be on this amazing panel with these great other co-presenters. But as you mentioned, I'm a psychiatrist. So before I went to medical school, I thought a little bit about gun safety, but since I've entered the field, it's an essential piece of the work that I do. It's impossible to do psychiatry and a good risk assessment if you're not paying attention to guns. And we realize that there's this interconnected nature of guns, suicide, mental illness, trauma, and violence. And again, not only the trauma to the people who are victims of gun violence, but their outward families and all the people that this impacts. So as I've engaged in my psychiatry work, I've seen over and over that there are times when our policy just isn't adequate to really address the health and safety issues that we're seeing. So I think that I decided to get involved and try to help on a couple of fronts. One is just the individual doctors. We as physicians have a large role to play in public health epidemics, including gun safety. And so I think it's important that we use our voices, our platforms, and we have a very privileged base with our patients where we have an opportunity to do a lot of education. So I think it's important for us to learn how to do that. And then the other larger piece is then how do we start to implement some of the policies that we know would provide the foundation for us to practice in the best environment that we can. So that's really why I joined Doctors for America, because I see it as an opportunity for us as physicians to come together, amplify our voice, and amplify that physician expertise so we can be a part of this solution and really make guns safer. And you touched on, there's this really exciting collaboration that we at Doctors for America are doing with Ceasefire PA, which is a video series with the goal of highlighting that importance of using those medical visits as an opportunity to do some advocacy with your patients and education, because those are really important times and touch points that we can take advantage of. So we know that having these conversations can be really difficult, and they seem daunting to a lot of physicians to start. So these videos can give physicians and other healthcare providers very concrete steps and ways to interact with patients to start having conversations. And so we've picked 4 areas to specifically highlight to teach some skills to healthcare providers. And those are domestic violence, extreme risk protection orders, a mental health visit, and then just a general discussion of safe storage. I think those are especially important topics right now in the face of COVID-19, because not only are we seeing an increase in gun sales, but we're also seeing an increase in new gun ownership. So a whole bunch of new people who haven't had guns before, and they might not have had that sort of basic safety information that we can play a role to increase. So it's also highlighted why we need extreme risk protection orders and why we need all the safety storage, all those general rules. It's just now in COVID, it seems like everything's amplified, and it's even more important that we do that. So there will be coming very soon these videos showing doctors interacting with a patient, talking about firearm safety and providing the resources, and how you can start to have these conversations. Because I think the integral part of these conversations is that we as physicians can't approach it as a pro-gun, anti-gun. And we as healthcare providers, a lot of us have biases, whether conscious or unconscious, about gun ownership. And that can come across to our patients, and that can be a problem. So I think we have to start changing the conversation from pro-gun, anti-gun to pro-patient and pro-safety focus. I often think when you have a conversation with a family about safe storage of cleaning products to help with child safety, nobody accuses me of being pro-dirt. But that's because Tide Pods don't have a long political history associated with them. But that's why we have to get comfortable in having the conversation and just normalizing that this is a part of our standard assessment and our standard talk. And just briefly, one other thing I did want to say, again, to the extreme risk laws, Wisconsin is a state that does not have an extreme risk law. So that's one of the things that I am very interested in working on, because like you mentioned, the majority of gun deaths are suicides, and that's increasing every year. And we know one of the most important, if not the most important step when someone is in the acute crisis is removing the means. And guns, by far, we all know, are by far the most lethal set of means. So if we can just delay, we can make a big difference. So I think that's why those are really important, and I'm working for that here in Wisconsin.
Thank you so much, Dr. Janis. That's just incredible work. And I have to say that I was lucky enough to participate in a forum that was sponsored by Doctors for America. We were all in person, and so it was pre-COVID at Johns Hopkins. And I remember that Shira Goodman, who at the time led Pennsylvania ceasefire, and I think you and others from Doctors for America were there, and the importance of ERPOs and doing the exact kind of videos that you've now put together was really highlighted. So just want to say, it's really important in today's world, and we have more opportunities now than ever to come together, even virtually through Zoom, articulate these kinds of issues and work intersectionally to help address them. I think the importance of the education component around ERPOs is so absolutely critical. And I just want to applaud you and Doctors for America for taking that on and really helping lead the charge on the education front for a critical constituency. Healthcare providers are among the most trusted people in America, an enviable position to be in. So thank you for all of that. And I want to turn to each of you to just do some brief Q&A, and we've already gotten some questions. One question I guess I should just note is Eileen Zeller has asked how folks can access the Ceasefire Pennsylvania videos when those go up. Do you know that yet, or perhaps we can provide that back a little later, Dr. Janis?
We will be sending out a link to Doctors for America members, and that will also be on our website, which is Doctors for America, DRS for America. And we will be able to send those out and share those soon, but we'll make sure to get them to you so you can also send them out to your membership.
Great, thank you. Representative Dean, you already touched on this a little, and thank you for that, talking about the two bills with respect to extreme risk laws. One, providing a federal right to obtain an extreme risk law, and another, the other legislation pending before the House of Representatives, would be to provide more grants to states who have passed extreme risk laws to implement those. Right now, if my count is right, 17 states and the District of Columbia have passed extreme risk laws. I wonder if you could comment a little bit more about what you see as the prospects for those bills in this Congress, and perhaps in the next Congress, and speak a little bit about your views as a former legislator in the state of Pennsylvania. You've been right at the front and center now in Congress and previously in the state legislature, in a state where there are, I'm sure, many conversations you've had at town halls and other places with gun owners around these issues. And I'd love to hear your thoughts about how we can make these a topic of conversation that kind of, in a sense, are removed from politics and really are about public health. So
I think that's a great question. And I think Dr. Janis touched on something that I have to try to remind people when I'm talking about this issue. I'm not anti-gun. I'm not anti-gun ownership, even though that might be the way that I would be painted, particularly in the Pennsylvania legislature. I remind them that I have 3 boys, and my middle son is an avid sportsman and shooter. He actually took me to a shooting range. He said, "Mom, you're talking so much about guns. Have you ever even shot a gun?" And so thank you, Harry, for taking me. I went to the gun range. I actually was pretty darn good. So I'm not anti-gun. And that is one thing. We have to sort of disarm, to use that verb, disarm folks from, I'm not against the Second Amendment. I'm not anti-gun. I'm not anti-sportsman. That's one way we do it. So in terms of the prospects, I'll tell you the good and the bad. The reason I went through that history of what has happened in the 116th Congress, with Judiciary having the first hearing, with us marking up 3 bills that actually passed the House, and then the one ERPO bill for the one for state grants. I tell you that to say how encouraged I am. I remember walking out arm in arm, all of us in our orange scarf. I'm surprised I don't have it hanging around my neck right now. The days that those bills passed here, I walked out arm in arm literally with John Lewis and Mike Thompson. Mike Thompson's the head of the Gun Violence Prevention Task Force here in Congress. And I said to Mr. Lewis in particular, I said, "Mr. Lewis, we are so joyful that for the first time in so many years, in so many Congresses, we've actually passed universal background checks. How do I temper that against what we believe will be the inaction of the Senate, the lack of heart, the lack of intellect, the lack of wanting to save a life?" And Lewis reminded me, what we've done here today is important. This new majority chose to take up the question of gun violence and made a statement by passing this law. If the Senate fails to do their job, we just have to, as he always says, keep your eye on the prize. So elections matter. A new majority, a Democratic majority in Congress, elected in 2018, sworn in January 3rd, 19, passed 2 bills within 2 months, under 2 months, having to do with trying to save lives. That's the area for optimism. Of course, the obstacle is the Senate and Mitch McConnell. And it's not just these bills, but it's many others. In terms of the ERPO bill that is pending, and will it come up this Congress for a vote on the floor? I keep arguing for that, I have to tell you. And I'm not alone. I know that our gun violence task force here is arguing for that. I apologize, I'm beeping for the next vote. But I'm not foolish enough to think that we'll get that passed and the Senate will somehow miraculously pass it. Elections matter, and I don't mean that in a political way. I mean it in a legislative way. Legislative initiatives are the direct result or the direct reflection of the value of the majority. So if we can't get it done in this 116th, I pray and will work as hard as I possibly can to have these reintroduced, repassed, and hopefully signed into law by a new president. With that, I think I have to go vote.
Yeah, duty calls. Well, thank you so much, Representative Dean, for all you're doing again with respect to this issue, and especially around the issue of ERPOs in Congress. I did get a note through our chat function that actually it's 19 states that have now passed extreme risk laws. The number keeps going up. Thank you, Eileen Zeller, for correcting that. But I do think that the money that could come at the federal level, as well as the federal cause of action, are incredibly important bills. So I hope that if we can't get something done this session, we certainly will the next, and we will deliver an even larger gun violence prevention majority in both chambers, which is so important.
It really is, and thank you. I've had the chance, just to boast a little bit about Ceasefire PA, I've had the chance to work with them for many, many years now. Shira Goodman among them. She's now moved on to even more advocacy, but Ceasefire PA is still doing terrific work. And thank you to all the social workers, psychologists, psychiatrists for all the work that you do. Kris, thanks to Brady. Bye.
Bye, thank you so much.
Thanks.
Dr. Janis, I want to turn to you again, and I'm sure much of this will be potentially covered in the videos that we can't wait to see. But as you think about, as a practitioner, and also thinking about all the different kinds of folks who are on the front line as healthcare providers engaging with patients, what are some of the thoughts that you have to those who may feel a little shy or uncomfortable about raising this issue? And what are some of the ways in that you have found most effective to talk about these issues and raise the issue of extreme risk laws in an appropriate way?
Yeah, thank you. Like I said, I think these can be conversations that we don't get a class in med school or nursing school or pharmacy school. How do you talk to patients about guns? But that being said, we learn how to talk to people about a whole bunch of uncomfortable or stigmatized topics. So I think we have the training. We just have to basically polish off those skills and train. It's like any other muscle. You got to work it. You got to learn the skills, and you got to learn. So that's why I think these videos will be a roadmap to help with that. But it takes practice and it takes work. But I know a lot of people, you know, the first time you took a sexual history, it wasn't the easiest thing in the world to talk about people when there's a number of sexual partners. But now, as you get into it and you do that over and over, it becomes old hat and it's easy to do. So again, it's just about taking the opportunity and learning the skills. And then I think the other piece that's really important, that's a flip side of that, is you don't have to be the expert. You know, nobody, you don't have to know every statistic, every data point, every resource that's out there, but you can still start to have that conversation, do some basic education, and if anything, know who to refer people to. So if you have a place of resources, such as Brady, Doctors for America, something that's like that, again, you can say, I don't know those answers, but I know somebody who will. And then I think the other side too is that you may have an encounter with a patient. Well, first I should say these conversations really should be a preventative conversation. So rather than waiting until there's a crisis, use every patient interview an opportunity to start planning ahead so that if there is a crisis down the road, you will have a roadmap already written out as opposed to having to scramble to get something done. So again, we do domestic violence screenings, seatbelt screenings, things like that. Guns and talking about storage should just be part of the normal preventative health care that we offer. And then especially if we know somebody has had a history of suicide, depression, things like that, coming up with a specific plan in the case that you notice XYZ, maybe early signs that depression is worsening, or your family members notice that. What is the plan? Which of your family members is going to be the person you reach out to, et cetera. So concrete steps like that. And then, like I said, recognize that we have multiple touch points with our patients. That's a nice thing about doctors if we have an ongoing relationship. And you may not get across to a patient the very first time you talk to them about this, why this is important and why you care and why it really is about safety. But I kind of approach it like we do motivational interviewing. People come to us with a whole range of values, a whole range of experiences, and they're each on their own path on where they are on this issue. But if we can use our education and that engagement, and like you said, our trusted voice really, to share some of this information, we can start to move people along. And it might not be my 10th conversation with you, but maybe they have their 27th conversation with you, and that's finally when we have moved to the end of the line and we're all on the same page here. So I think those are my biggest pearls to kind of take away.
Well, thank you for all of that. I think that it's really fascinating to think about it in the context of something that we in the gun violence prevention movement have been thinking about actually for a long time, which is how can we normalize the conversations about guns in the home? How can we make it something that, I'll just use an example. I have two daughters who are now 16 and 18, but when my 16-year-old was born, she was diagnosed when I was trying to transition from breastfeeding to bottle feeding with severe allergies. We couldn't find a single formula that worked for her. She was allergic to milk. She was allergic to eggs. She was allergic to certain kinds of nuts. And that became a long odyssey until she outgrew many of these allergies. As she was getting older and would go on play dates, I would always ask before every play date, do you have milk? Do you have eggs? Do you have, and of course the answer was yes. What things do you have for her to snack on? I would bring her own snacks. And I was never shy about doing it. I never felt that I was imposing on individuals to do it. If you think about the risk associated with having a loaded and unsecured gun in the home, that is a material risk that gets evidenced with family fire every single day. That's the 8 kids a day who are killed or injured with guns in their home. Why is it that the question around gun ownership isn't something we ask each other, and that trusted individuals like physicians and healthcare workers and social workers aren't freely asking those questions? And I think part of it is that the issue of guns has become sadly politicized when it shouldn't be. But I think a big part of the remedy is exactly what you're talking about, and normalizing those conversations and making sure that they happen, because the more they do, the more normal it is to ask the questions. So what you're doing is both important situationally to what you're doing, and then profound if you think about the network effect. And so that then I'll turn to you, Mel, to talk a little bit about that, because what you're doing on behalf of NASW is really a different avenue and trusted source of information to your clients. Can you talk a little bit about how you're incorporating issues around gun ownership and also extreme risk laws in your training for social workers who are engaging with their clients every day, often in their homes?
First, I have to do a little bit of a caveat. I work for the national office, so I'm not directly involved with training. And as you know, social workers work for agencies, private practice. So where they get their training, the content of that training is something I wouldn't exactly know. But one of the things I can respond to, especially around dealing with gun storage and those prevention side of it, there's a whole cultural aspect to this that needs to be approached. For instance, we use the term ownership of guns. Well, we talk in the cities and other communities, there may not be ownership in that classic definition. It may be a gun that they got through illegal means. So when you bring that up, you have to be aware that if you're talking to an adult or perhaps a teenager, would that kid feel like they're snitching if they say that? And so you have to really design it in that cultural context. And that's not just say that in the African American or in the Latino community. That's in different cultures where when you broach that subject, it elicits different responses to it. Some has to do with fine, we could talk about this. Other times there is a tension, a distrust, should I share? So you have to be really, really creative of how you broach that. And having said that, I'm not saying that social workers don't have that conversation or not willing to have that conversation. What I'm saying is that the training, and this is a lot on our part as NASW and our national office, is really getting as much information out there about these issues and the critical nature of them. But we just don't make any assumptions that if you work for agency A, that you're allowed to have a conversation, number one, and that there's some training around how you broach that subject and how you recognize the cultural issues around that.
Thanks, Mel. Yeah, I appreciate that. I guess one question I'll turn to both of you for those who may be listening and just wondering what more they can do to educate themselves and lift up their voices with friends or neighbors or others in their community around the issue of safe storage and perhaps extreme risk laws if they have one in their state. Do you have any suggestions for resources or tips or more information? Certainly I do, but I want to turn to both of you that they may be able to access that can help them either from a professional standpoint, if you want to speak to directly to healthcare workers or social workers, or just to the general public who may have an interest in this issue, may feel shy about it, and want more resources to be able to help understand where they can really make a difference around the issue. And I'll turn to you first, Dr. Janis.
Great, thank you very much. Yeah, I would say, well, first, if there are any physicians out there, please join us at Doctors for America. It's totally free membership, and there are a whole list of volunteering activities, ways to sign up and keep involved with what's going on. Even if you're not a physician, I would still suggest checking out doctorsforamerica.org, our website, because there's a lot of resources and ways that you can also get involved and start to learn some of these, the issues in your area. That being said, I think it is important that I'm a big believer in, we have a much bigger impact together than individually. Like there is, obviously there are individual things that you can do, but our voices just get louder and much bigger when we come together. And so I would say one of the other things that I have found to be helpful is to actually go in spaces that don't focus on gun safety, that are maybe more traditional medical advocacy groups, things like that, and make sure that I'm in the room when they are talking gun safety, or I'm just in the room to make sure that they are even discussing this as part of what's going on. And again, I think it goes back to that normalizing conversation. There are a lot of places that probably are doing overlapping work and have some influence, but maybe aren't focusing on this area as much. So again, as we go in and say, I'm here, and I've got some resources from Brady and for Doctors America to share with all of you, and spread that message within those organizations as well, is another way to get involved.
Thank you, Dr. Janis. Mel, do you have anything to add to that?
Not much. I think that Dr. Janis really hit on the key points. What we do, or I do, is refer to, like Brady, actually Doctors for America too, to our social workers as resources. But I suspect, and I pretty much know, that different agencies do have some documents, pamphlets, safety information around guns, and that to get our clients and for our social workers to talk to their clients about accessing that literature. Also, APHA has done some good stuff around gun prevention, and there's literature out there. But the best that we think that we can do from a national organization and being at the national level is to get as much information out there to our individual social workers so that they're able to talk to their clients well. So, but that's pretty much where we're at with it. Did you hear?
Yes, I did. Sorry, somehow I nearly got booted out of the Zoom.
Oh, okay.
So I'm so grateful to be back.
I sort of panicked. I said, what happened?
Me too. That makes two of us. Thank you, Mel, for that answer. And we do have a few questions from the audience. So with the time remaining, I'd like to turn to those questions. And for those of you who are participating right now, feel free to use your chat function to ask any questions. We have just over 10 minutes left, and happy to take any questions that you might have. The first question is from Laura Williams. For those states that have extreme risk protection order laws, do you have suggestions on how to get information about the existing laws out to the people who need it? We are looking to partner with a local food pantry, but it is really challenging to educate the audience who needs to hear it. And thank you for that question, Laura. You're right, every state, well, now we know that 19 states and DC have passed extreme risk laws, and each of them looks a little bit different. Typically, there are kind of 3 different approaches, sort of, that have been taken in passing extreme risk laws. Some of the states only allow law enforcement to seek the orders. Other states have expanded who can seek an order beyond law enforcement to include family members and other trusted individuals. And the process in each state for seeking an extreme risk law can look a little bit different. I would encourage you to visit Brady's website at bradyunited.org. We do have resources there that provide some basic information about the states that have enacted extreme risk laws and what some of those differences might look like. And what I'll do is check with our policy team as well, and hopefully get more information during this chat, and can let you know, or at least follow up with you on some other resources that provide even more digestible information to key constituencies in those states that might be on the front lines of potentially having to seek an extreme risk protection order. There are those materials out there. They can look a little different state by state, so it might be helpful to know, Laura, what particular state you might be interested in finding out that kind of information, and we can get back to you with that more specific suggestions about where you can go for that. And thank you for that question, because it is really important and points to the issue that if you are in a position where you're working with someone and or considering the applicability or the efficacy of an extreme risk law, understanding the state law where you are is a really important component of that. Mel or Dr. Javis, do you have any other comments on that question, or should I move on to?
I would say very quickly, we have chapters in every state. So in those states where there are IRPA laws, our chapters probably are, chapter EDs, or executive directors, are probably informed. So it wouldn't do any harm to reach out to an NASW chapter within the state that she's concerned about.
Thank you, Mel. Thank you for that. We have another question here from Pelly Anderson. The question is, given that law enforcement is an essential party to safely implementing IRPOs, is there a concern that people may be less likely to trust law enforcement given the current protests? And number 2, if so, what should we be advocating to ensure IRPOs will continue to be safely and widely implemented as we move forward with the conversation of law enforcement reform? I think that's an important question. I mean, part of the, and Mel, you kind of touched on this in your prior answer. Of course, law enforcement are on the front lines typically in executing an order that might call for the removal of guns for someone at risk. That's not necessarily the typical way that an extreme risk law always works. Often people can also voluntarily turn over their guns. And so what we're really talking about here, I think, is very important, which is how can we enlist others who are on the front lines of thinking about extreme risk laws to educate the general public, parents, others in the home, for the signs of risks that may prevent having to go to the extent of getting an extreme risk law in the first place. There's a whole series of cascading things that might happen that cause an IRPO to be issued, and a lot of points of contact before that could happen, in which, for example, as Representative Dean talked about, in which others who are trusted might be able to have conversations that facilitate the voluntary relinquishment of guns. I think if it does come down to the execution of an IRPO, and I'd be really interested, Mel, in your thoughts on this too, and Dr. Javis, one of the things that's very important, obviously, and so much of what we're talking about in reaction to the horrific use of lethal force that we have seen in the last several months, is training and understanding how to de-escalate situations in a way that does not involve the use of lethal force. That has to happen across the board. And certainly with respect to the execution of IRPOs, what's obvious about that, and what's obvious, frankly, about this whole issue holistically, is that not only protects the citizens in a way that the police departments were created to do, it also protects police on both sides of the equation. So I think we really need to think about how we train the police, not only in the execution of ERPOs, but in the execution of all of their functions, and de-escalation has to be a critical component of that. I see you're shaking your head vigorously in agreement there, Mel and Dr. Janis.
Yeah,
Do you have anything to add?
Yeah, you said it. I think I actually just read, I mean, literally 2 hours ago, an article on this, and it was from a doctor's group, I'm forgetting what group it was, but they made really an important suggestion that because of the tensions related to executing that there should be some planning with law enforcement and the family, they're saying, is to figure out ways where it is a prevention action is taken, that there to prevent a weapon being used by police. It is an intervention to prevent something. It's not an intervention to arrest or to shoot someone. So that, and they brought the whole issue of trust, they brought the issue of race and trust, so that when that situation arises, there has to be that recognition the most trustful person may be the family, but given it's a dangerous situation, the police could be there. So that part that you're talking about in the training, maybe that's the part where the police are trained, but also to work with family, social workers, others that can mitigate the possibility of a lethal action. This is a tension-filled activity. Somebody's knocking on the door, I want your gun. It's not guaranteed it's going to go well. So that the piece that I read, to me, just made an awful lot of sense. And that's where a lot of the dialogue is going now about the issue of police reform in terms of police being pulled away from activities that don't necessarily require law enforcement. Maybe some backup from law enforcement or collaboration with law enforcement, but it isn't a dominant law enforcement issue. And domestic violence, again, is another area where this is important, because that de-escalation, but always preventing that possibility of lethal force being used. So yeah, I was shaking my head. That's what I think that's really, really important.
I think that's a really, really important point you're making, Mel. I know that when I was reading the study that was undertaken, looking back at Connecticut's extreme risk law, one of the things that they said was really important to the success of that law, actually really drastically reducing the incidence of suicide, was linking the extreme risk law with access to quality, affordable health care in that state. And obviously that took a lot of training and implementation within the state to ensure that happened. I wonder if you might comment on that, Dr. Janis, because we've gotten a question, and maybe we probably have time for one more question, so I'll ask you to kind of wrap this up for us, because the question is focused on one side of the coin. The question that has come in is, if someone tells a doctor they have a firearm in the home, are social services going to arrive at their home to inspect? So if a client or a patient raises these issues with you, how do you typically handle, and how would that be informed? And then how do you think about linking clients to other kinds of services if it does seem that they are at risk of harming themselves or others and they have a gun in the home? Maybe you could talk a little bit about that.
Yeah, I think that's a complicated question, right? So right now, well, I will tell you one of the things right now, if somebody comes and talks to me, there's not a whole lot I can do, because again, in Wisconsin, we do not have a law right now. So the option is, let this person go or emergently detain them. And that actually, I think, connects, at least for Wisconsin, very well with sort of where the police, what is their role, especially when we're talking about these more mental health cases. Because it so happens our law here too is that if someone is emergently detained for mental health treatment, it is the police doing that as well. So I think all of these conversations are about safety, and the goal of safety, both reducing gun risk, but also increasing safety towards people seeking mental health care elsewhere, is that we know that not only does the gun have risk, but the actual interaction with law enforcement has a risk, especially for people who are Black or Hispanic or minority in this country. So we have to really weigh those risks easily. But I think to the larger point, this is why we have to do, as Mel said, a lot of preventative work. Like, the more that we can have these conversations as part of the standard treatment plan, just like if someone has a risk of overdose, when they're not depressed, I will sit and talk to them. Okay, when you're noticing you're getting more depressed, let's take your pills and let's get them to your family. And this is the plan that we're going to do. And this is when you're going to call, et cetera, et cetera. You have a real plan to be able to do those ahead of time. So that it doesn't just seem like at the very end you have to call the police and get somebody to someone's home, or whatever the particular law is in your state about how you get those out. But I also think that that's important. I mean, just a general practice of our care here in mental health care, but in healthcare in general, is that we establish trust, and we need to have good rapport with our patients and establish that trust. Make sure that, and that's why I said I think it's so important to meet them where they are culturally, where their values are. And so if I have that long-term relationship with someone, they're going to be much more likely to be able to share with me, because I've approached this in a non-judgmental, non-stigmatizing way through all the conversations we've had before, that they know that they can trust me, that even if there is a risk, I'm not going to inadvertently get them to a place that's not going to be helpful for their long-term health.
Thank you. And I know these issues are complicated, so thank you for answering it both from a perspective of within Wisconsin and then even outside of Wisconsin. And I just want to say to both of you and to Representative Dean, who had to go off to vote today, thank you so much for your time, for your focus on this issue, for joining us and really helping make sure that these laws aren't just passed, but are implemented in a meaningful way. We can pass all the laws we want to, but ultimately it's the people who are on the front lines of making sure that those laws become reality in people's lives that are so important. And we do have a common epidemic in this country of gun violence, and we have 8 kids a day, for example, who are killed or injured with guns in their own home. The beauty of this conversation is that we can actually activate so many people across the country and trusted individuals to really help reduce that number and even eliminate it. It is absolutely in our hands to do that. And I want to thank the National Association of Social Workers, Doctors for America, for helping lead this conversation and for helping really make a difference around this issue. Thank you all, also the audience, for participating today, for your interest in this issue. If you want more information or want to forward this particular webcast to those who you think would be interested, it will be permanently held at bradyunited.org. You can find it there along with a host of other information about a host of other sources of information related to this issue. And I also just want to call out before we close that Eileen Zeller has forwarded at least one of the resources, and we'll try and put more on our website, that provides implementation information about IRPOs across the states. You can find that at the Hopkins Bloomberg School of Public Health, and there they have an IRPO implementation website. So I'd encourage you to look there as well for more detailed information about what's happening in implementation in the state where you might reside. So anyway, we'll close with that. Thank you all so much. Thank you for your time, and thank you for your commitment to this cause of gun violence prevention.
Thank you.
Thank you so much.
Thank you.
Bye-bye.
Bye, everyone.